This is Robin Dennison. We're going to be talking about classroom assessment techniques as a component of formative evaluation, and this is Module 6 of 628. So the objectives that we're going to cover in this particular webcast are to compare formative and summative evaluation and describe classroom assessment techniques that can be used for formative evaluation. There are other objectives in this particular module, but this particular webcast is going to focus on those two objectives. So you're going to hear these terms a lot, and I want to start by just describing the difference between summative and formative evaluation. And then we'll be talking more about these concepts throughout the entire semester. When you're evaluating along the way, as in formative, then that's called formative evaluation. And when you're doing formative evaluation, you're generally really evaluating your teaching more than you're evaluating their learning. And so as you're doing formative evaluation, you're trying to find out, are you being successful in helping this student learn, and how can you adjust things to make sure that they are able to learn. A summative evaluation is an evaluation of the student's learning, and it is typically at the end, of course, of a module or a midterm, the end of a course. Sometimes we have evaluations that are at the end of a curriculum, kind of a final outcome evaluation before graduation. So remember, formative is assessment for learning, and summative is assessment of learning. Typically, formative evaluation is not graded, or if it is graded, it's weighted very, very low. My recommendation is you don't really use formative evaluation for grades. That's not its purpose. On the other hand, certainly summative evaluation is for grades. So again, we'll be using these terms a lot. So formative evaluation as in formation, right? And it is the foundation of classroom assessment, and it guides revision and facilitates improvement of your classroom instruction and of student learning. I found this great little comic, and I think that it makes the point quite well, and that is, the caption here is, what if pilots didn't use formative assessment? So they take off and they just fly 5 hours and they don't end up to where they wanted to be. And I think this is what happens sometimes with us as teachers, is if we're not kind of doing little stop points along the way to say, where are we, where are we, where are we, where are we, then we may very well not end up where we want to be. So that's what formative assessment is really all about. Classroom assessment techniques, again, focus on learning, not on evaluation and grading of students' efforts. So these are things that you can use throughout your class sessions to evaluate how students are doing. One of my favorite ways to do this, because I do teach a lot of continuing education programs, and that means that I do have, because I do a lot of certification reviews, that I have like 8 hours of basically lecture discussion as I prepare students for their certification exams. I put a lot of these kind of things along the way in my PowerPoints. I do practice questions, I do matchings, I do fill in the blank, I do little teeny case studies to what I call a clinical challenge, to stimulate them, make sure they're there with me, and just to break things up. What we know is that people can't really concentrate for extended periods of time, and so at least every 15 to 20 minutes you have to say, okay, let's shift gears, let's do something different. Okay, let's shift gears, let's do something different. So these are little stop points that you can put in your PowerPoint, which again make sure that you do stop and do something different and kind of assess where they are in terms of their learning. I frequently will even put that stop sign on that slide so that they know that this is, a stop point. We're evaluating their learning. So questioning, let's talk about that first as one of those things that we can use in terms of evaluation in the classroom. It aids in critical thinking and engagement, right? Are you with me? And then to use questioning in the classroom, you need to formulate the question clearly, and it helps many times to go ahead and put it on a slide. That way you know that you phrased it in the way that you want it phrased. Allow time for the learners to kind of consider and offer answers. I would never call in specific learners. That offering answers certainly should be voluntary. I think that's a very important principle of adult learning that we must always keep in mind, is that adult learners need to be able to offer answers and not be called upon, because it's very threatening to them to be called upon when they may not know the answer, and they get embarrassed very easily with being called out in a group of people, and that certainly stifles learning. If the answer is incorrect, and again, there's so many correct answers that sometimes it's just, oh, that's an interesting way of looking at that. Rephrase the question if the answer that you got was totally, off base, and say, well, that's interesting. That's a good answer to this question. Let me ask this question in a different way. And that way, hopefully, you can get the discussion going about the question that you were asking. Be very careful, obviously, about embarrassing learners. The last thing you want to do is to say, oh, wow, that's a stupid answer. I know you would never do that. But in some ways, that's an undertone that can come across in the way that you respond back to students, learners. This is one that I use. I just put in a few examples of ways that I do this. So, for instance, and it didn't come upright, well, I'm sure in the way that you're doing it, but imagine that what you see is everything except increased left ventricular afterload. And that is that this slide comes up, and I have a whole series of these where I ask students to identify what is predominantly affected by this condition. And so this is aortic stenosis, and what's a predominant effect of aortic stenosis is the increase in afterload on the left ventricle, which is why they develop left ventricular failure. So if you can imagine, again, left ventricular afterload flies in after they've had a chance to kind of think about this and come up with their answer. This is another example, and again, the red part, the bottom part, would not show up initially, and that is that can you have hypoxemia without having hypoxia? And so you start first by describing what is the difference between hypoxemia and hypoxia, and then, can you have hypoxemia without having hypoxia? And then as you give the example or talk about the example of a patient with COPD, who runs around all the time with a PO2 of 64, which is certainly hypoxemic, but are they hypoxic? No, and that's because they increase extraction at the tissue level, and so their tissues are still okay, therefore not hypoxic, but certainly their blood oxygen level is below normal, therefore hypoxemic. And so it kind of helps them think about these concepts of what do these two terms mean. And again, I always ask after this question, at what point does hypoxemia pretty much guarantee hypoxia? And we know that that's, a PO2 of 60, O2 sat of about 90, that when we go below that, increased extraction is not adequate to allow the tissues to still be okay. So this is, again, it's a conceptual question. It asks them to think about this issue. These are just some examples from some of my slides. This is a matching, and this is a template that I use where you can kind of put these things on there, and then under normal circumstances, the lines kind of fly in at the end so you can match. So of course, as you look at this, When we think about, what blocks potassium channel, those would be class 3s. What blocks calcium channel, that would be class 4s. What blocks beta receptors, those are class 2s. What blocks re-entry, that's adenosine. It doesn't fit in the von Williams classification system that I'm describing here. And then blocks sodium channel, that's class 1. And again, when I use this slide, those lines fly in and we do one by one by one. We've already talked about this. Keep in mind, we've already talked about these antidysrhythmics when I use this slide. This is a review to say, do you know what these classes mean? Here's another little, as I call, just a very brief clinical scenario. And that is your patient is in cardiogenic shock, which would be the preferred drug. And this brings in the physiology of, we know that blood pressure is equal to cardiac output times systemic vascular resistance. So in cardiogenic shock, which is the problem? Is it cardiac output or is it systemic vascular resistance? Well, of course, we know that their cardiac output is low and their systemic vascular resistance is high. So the last thing we want to do is increase the systemic vascular resistance more. We want to increase the cardiac output more, and therefore the preferred drug in cardiogenic shock to increase the blood pressure would be fix the problem, right? The problem is the cardiac output, and the preferred drug would be dobutamine. I then frequently will shift this question and say, okay, now you have a patient in septic shock. Now the problem is the SVR, which would be the preferred drug. In that case, of course, phenylephrine would be the preferred drug because it's going to restore normal vascular tone. And so again, this little clinical scenario helps pull in the physiologic concepts with the pharmacologic concepts. And initially, when you look at this slide, the dobutamine and the neo is not there, right? So you're asking them to kind of say, well, what's the problem? How can I fix the problem? And that's the way I relate this particular concept. Fix the problem. Identify the problem, fix the problem. So you can see those are just 3 examples of classroom assessment technique or classroom assessment evaluation, these formative evaluation techniques that I use. Little quizzes. A lot of times people give weekly quizzes, and that's to evaluate, many times it's to evaluate if they've completed their preparation or if they've comprehended. If you're going to do that, then I think that you shouldn't use them in your grading system if they are truly formative, okay? Sometimes what you can do is to give a quiz at the beginning of the session and then give the same or similar, right, quiz at the end. And I've certainly done patho for undergraduates where I gave a quiz every single week. And then what I did was I allowed them to throw out their lowest one. But I did grade them. So again, that was primarily for evaluation because they were graded. If you're using it as a formative evaluation methodology, those grades would not count. They do reinforce to the student, gee, I really wasn't prepared as well as I should have been, even though they're not being included in your final grades. So my point here is, decide if your quizzes are formative or summative. If you're doing it at the end of each module and you're going to count them, then of course they're summative. Polls. Students really love these polls, and we can do these with Adobe Connect or Blackboard Collaborate. There are various and sundry formats that you can use with these polls. You can have multiple choice questions, you can have true falses, you can have fill in the blanks. So sometimes they're used at the beginning, sometimes they're used at the end, sometimes they're used throughout. Clickers are kind of the same thing, and that is that it's in class, whereas polls are generally online. So clickers are in class, and you're asking questions, and then students identify what their answer would be, and we can see how much of the class is totally off base, how many in the class are really on this and understand these concepts, and we can move on. So it does really help you in terms of, again, how are you doing? Are they understanding the points that you're making? By the way, you have another webcast on clicker specifically. The 1-minute paper, I know I talked about this in another session, and that is what was the most important thing you learned today, what point was most confusing for you today, and you can ask them to do those 1-minute papers at the end of the session, and then you can look at those and decide what you need to be clarifying for the next session. Exit tickets, this is another way, and that is you ask students to write the answer to 2 questions on a small piece of paper. You could give them an index card as they come in, and one of the questions that you'll put up on a slide at the very end should be very factual from that day's content. And then the other questions should require more of an essay, should require more of an explanation of a concept. And so you give them 5 minutes to answer these questions. They don't put their name on the card, and then again you collect them, and it helps you clarify what got through and what didn't get through so well. And then you start with that clarification at the beginning of the next session. Other methods of formative assessment are to do, different computer program activities both in your PowerPoint or at the end. And I just wanted to introduce you to a website called Hot Potatoes, and you can Google it and find this. But it has all kinds of little free quizzes, matching, mixes, different, I don't want to call them gaming, but in essence activities that can be used for formative assessment. Oh, there's a website, eclipsecrossword.com, or just Google Hot Potatoes, because again, there are various and sundry, and this is free, software that you can use to develop these things. I love using crosswords. I'll use a crossword for you at least one point in this particular course. Crosswords are great for terminology and linking simple concepts. Obviously, they are not critical thinking, but students really love crosswords, and I like to use them. And then finally, just a final note about summative evaluation. Remember, this means evaluation through testing or through papers or presentations. They are graded. That grade is, we sometimes call this high stakes summative evaluation because it truly is so high stakes for students. It means will they be continuing with their program? Will they be able to, practice? When we talk about NCLEX, it doesn't get any higher stakes than NCLEX. And so these are, definitely very important in terms of progression in the program as well as progression in their career. Summative evaluations are not for teaching. It is an evaluation. I team taught with someone one time that she and I clashed throughout the entire semester because she would repeatedly say things like, well, I want to put this question on the exam because, because they'll learn da-da-da-da-da from this question. And I would be like, testing is not for teaching. Testing is not for teaching. Testing is for evaluation. You teach before evaluation. You don't try to teach through your test. This is a very important point, and one that I feel strongly about. It is not fair to students to be thinking about trying to teach during an exam. The exam should test what you have already taught or facilitated their learning of. Just one of those things that again, I think we have to clearly identify in our mind between teaching and evaluation. Teaching, facilitation of learning, evaluation. So summative evaluation, again, this is for grades, this is for progression in the program, this is for eligibility to sit for NCLEX, this is for eligibility for practice. These are high stakes, and certainly it's why we're going to spend 4 sessions in this particular course on evaluation, because the test that we give and the evaluation of these summative forms of evaluation must be very objective and must be totally and absolutely fair to students so that they can, again, progress in school, progress in their career, and practice. But that said, it's very important, obviously, that students are prepared, right? We want to make sure that we're allowing students who are prepared to progress, but that we're also safeguarding the safety of their future patients. So safety of future patients is really kind of bargained against the needs of that student. Both of those are important, but we always have to be thinking about the safety of the future patients of those students. And we're going to talk a lot more about that. So that concludes this particular webcast, and we'll be talking more about all these concepts in your life seminar, and also a lot more about summative evaluation toward the end of this semester. Thank you.